All right, we're going to continue with Module 2. And in this segment, we're going to talk about what I think are some false beliefs of staff and staff training. I kind of touched upon this earlier. I want to show you some research and some data on our beliefs of staff training, just so you as an RBT know, or if you're a supervisor watching this, know some of what we think is important and what not to do or what not to consider in saying that an RBT is qualified to implement behavioral intervention to individuals with autism and their families. So there's many pitfalls that I see. Many pitfalls in terms of what makes someone qualified, or when training is done, or when supervision doesn't need to be as intense. One of these pitfalls, which has been mentioned, is measure of competency. The final measure of competency of an RBT is a multiple choice exam. It's a multiple choice exam that the RBT has to take where they're answering questions based upon the task list. This is somewhat similar to the multiple choice exam that BCBAs or BCABAs make. Now, for years at Autism Partnership, my colleagues and I have talked about how we do not feel this is a sensitive enough measure in terms of saying that someone is qualified or is not qualified to provide behavioral intervention to individuals diagnosed with autism. We fully understand that this is just one component of training, one component of the RBT certification. We understand that 40 hours of training is provided. We understand that there's now a competency-based exam. But we really encourage that the final performance, the final measure of competence should be a performance-based exam. It is, once again, more important what you can do than what you can say you can do. So we wanted to look at this because we've been saying this for years. We wanted to actually look to see about competency and see if there was a correlation between performance on a multiple choice exam versus performance on actually implementing behavioral intervention to individuals diagnosed with autism spectrum disorder. So we took 25 participants. Now these participants, some of them would be at the RBT level, some of them would be at the BCABA level, some of them would be actually at the BCBA level, minus that they don't have the BCBA certification. So they're not actually BCBAs, but they were practicing to one day become a BCBA. They do not have that certification yet, but they were in line to try and achieve it if they pass the exam. Now, what we did was we compared their performance on a multiple choice exam, and I'll get into that momentarily, how they performed on a multiple choice exam, to how they performed implementing discrete trial teaching, conditioning reinforcers, and overall behavioral intervention. Now, the discrete trial teaching, conditioning reinforcers, and overall behavioral intervention is stuff you will be hearing later in these modules. So the purpose of this study was to assess the correlation between their performance on a multiple choice behavior analytic exam and their implementation of behavioral analytic procedures as they actually implement with children diagnosed with autism spectrum disorder. Another thing that we've seen in the staff research is a lot of times that performance is based on using a confederate. Whether that's a typically developing child acting like a child with autism, or whether it's an adult pretending to be a child with autism. We think that's not great. We think it's more important that you can actually work with a child with autism than a confederate. So as such, we looked at how they could perform various tasks with an actual child diagnosed with autism spectrum disorder. So this, I will go over the different dependent variables. First, we had a mock exam. We had 4 dependent variables, the first one being a mock exam scores. We wanted to see how they performed on different mock exams, on different questions within a mock exam. We also scored them on how well they implemented discrete trial teaching with a child with autism, how well they were able to condition a neutral stimulus, neutral item, as compared to like a preferred item with a child with autism, and how well they implemented brief behavioral intervention and more comprehensive intervention. I want to go through each of these different variables in better detail right now. So the mock exam score was from a company that provides training modules on how to prepare for the BCBA exam. It's a well-known company. It's a company that we have permission to use. It's a company that guarantees if you pass all the modules and do all the trainings that you're likely to get your BCBA certification, pass the test. If not, you'll get your money back. I think they say that they have like a 91% pass rate, at least at the time of our study. For our study, we didn't use the module portion of it. All we used was the exam. They have a comprehensive pre and post exam. We used the exam. And the exam had 12 different content areas, 12 areas, questions from these areas. One of them was on measurement, so they had measurement 1, there's questions based on that. Experimental design, there were questions on that. Behavior change considerations, fundamental elements of behavior change, specific behavior change procedures, behavior change systems, identification of the problem, measurement 2, so more questions on measurement, questions on assessment, questions on intervention, questions on implementation management and supervision, and questions on professional and ethical behavior. So some of these questions do not actually apply to RBTs, they're beyond the scope of the RBT, but there are questions that overlap. And so what we were really evaluating was on their ability to answer the questions correctly. Second, what we really were looking for was discrete trial teaching scores, how they performed on discrete trial teaching. And we broke discrete trial teaching down. We task analyzed it so that we can objectively score performance on discrete trial teaching. We were looking first that they provided clear instruction on every trial. So if they were teaching them to expressively label something, they had to say something like, what is it? Give me its name. Tell me who it is. Versus an unclear instruction, which would not indicate what was needed from the learner. They provided instruction that matched the student's comprehension level. So if the student had lower receptive language, then they would have a less complicated instruction. If the student had more receptive language, their instruction can be more complicated. We want to make sure that they provided the instruction only one time. So if they were showing a picture of Batman, they would say, who is it? Just once. They wouldn't say, who is it? Who is it? Who is it? Tell me his name. We wanted them to only provide the instruction one time. And when we get to the discrete trial teaching module, you'll see why this is important. They did not provide any readiness cues. We didn't say, look at me, or look. We didn't provide a readiness cue. We were looking to make sure that they were not providing that readiness cue. We, though, wanted them to establish attention prior to the instruction, and we would score if they did this. Now, they could do this through shaping, something else we will talk in different modules, by simply reinforcing when they were attending. Saying, wow, you're looking, okay, who is this? But not doing it artificially where they're trying to establish their instruction, rather establishing it through the use of reinforcement. We wanted them to reinforce and praise learning how to learn behaviors. So we want to make sure that they reinforce and praise that learning to learn behaviors. Place at least 3 stimulus in front of the student. So if it was a receptive task, they would place 3 stimuli in front of the student. Not 2, not 4, that the 3 would be placed in front of the student. And that they would rotate the stimuli at some point. They didn't have to rotate the stimuli after every teaching trial, but at some point they rotated the stimuli within that teaching session. We want to make sure that there's a variety of instructions. So it's not just touch Batman, it's where's Batman, find Batman, where can you find Batman, touch Batman, point to Batman. Those would switch on every teaching trial. They begin each trial with an instruction or prompt. So if they were prompting, we wanted to see the prompt happen before the behavior of the student occurred. Then we were looking to see if they provided 5 seconds for the learner to respond, and that all prompts, as I said, happened before, following the instruction, but before the behavior. We were evaluating if they were able to fade prompts systematically across trials, so that they were not providing a prompt in every trial, or that they didn't need to prompt on every trial, that they can fade it over time. They provided corrective feedback when the student got incorrect. So if you said touch Batman and they touched Superman, you're saying, you know what, that's not it. Oops, you got it wrong, try better. Or they can provide instructive feedback, nope, that's not it, here's Superman, or here's Batman. And then when they engage in correct responses, that they provide reinforcement. Hey, I love how you touched him, that was right, bingo, good job. Hey, that is Batman, providing that type of reinforcement. So these are the behaviors that we were looking for in discrete trial teaching. And as you can see, it's a 15-step task analysis. Now, we looked at conditioning items. So we took a preferred item and a neutral item. And we wanted the participants to take that neutral item and attempt to make it more preferred than the preferred item. And we broke this down into six steps, six-step task analysis of things we were scoring the participants on. We wanted to see if they demonstrated a functional way to interact with the item. So we were seeing if they were interacting with the item in a functional way. We also wanted to see if they interacted across the session in novel ways. So it's not just always playing with the item the same way. So the fire truck, if they had a fire truck, was not always just putting out fire. Maybe it was racing around the city, something like that. We wanted to make sure that they maintained favorable effect throughout the interaction. We wanted the teacher to be excited, to make sure that that interaction was exciting, so that they're putting on a happy face, they're smiling, they look like they're happy to be there, they're wanting to condition the item. We wanted to see if they interacted with that child differently, if that child showed an unfavorable effect. So if they're engaging in the item and the child doesn't look happy, is the therapist, is the participant going to change his or her behavior? Are they going to change the way that they play with the toy based upon what the learner is doing? We wanted to see if they would incorporate how the student interacts with the preferred item or other preferred items into that interaction. So if they realize that the student doesn't pick the fire truck, let's say, and they're picking a clown and they're doing something with a clown, that they're going to start having the fire truck do things like the clown does. That they're going to talk about ways and interact with ways that the child likes. So if they figure out that the child likes dinosaurs, how can they incorporate dinosaurs into that interaction? And finally, we want to see if they provide choices. We want to see if the participant was really seeing if the child preferred the preferred item or the neutral item, and the best way for that was to provide choices to the participant. So that was the items of how we were scoring participants on the conditioning items kind of analysis condition. We also looked at social validity. We had them engage in behavioral intervention, which I'll describe momentarily. And we gave out videos of each participant engaging in behavioral intervention and asked professionals who've been in the field for numerous years how they liked the videos. And we asked them to rate it on a 1 to 7 scale, with 1 usually representing that it is not acceptable, and not likely, or not interested, or not appropriate, or rarely occurred, with 7 being highly acceptable, highly likely, highly interested, very appropriate, or always occurred, and this varied upon the type of question. So there are a variety of questions which I'm going to talk to on the next slide, and our experts rated each participant's implementation of behavioral intervention on this 7-point scale. Here are the questions that we asked those professionals to rate the participants on. I found the interventionist approach to teaching acceptable, so they have to rate that on a 1 to 7 scale. I would like to likely hire the interventionist to work at my agency, 1 to 7. This is important. We want to see if these professionals would hire the participants. If they said, you know what, they're good enough to work for my agency. Keep in mind that the scorers of the videos didn't know who these people were. They didn't have any interaction with them. They had no history with them. The interventionist looked interested in the child. It's important. We talked about that. This is child-driven. We want to see if these professionals rated the participants as looking interested. The interventionist appears to have a foundational knowledge of behavior analytic principles and procedures. We just talked about this on the previous segment. We wanted to see if the professional said, yep, they look like they understand behavior analysis. The interventionist used behavior analytic procedures and principles effectively, pretty much. We want to see what they thought about their implementation of ABA. The interventionists provided an appropriate amount of learning opportunities. We wanted to see if they thought that they were providing enough instruction throughout the periods of time. The interventionists provide an appropriate amount of reinforcement. Are we doing a good job reinforcing behavior? Are we spending enough time in reinforcement? The interventionists provide an appropriate amount of corrective feedback. We wanted the professionals to rate, are we actually saying no? Or actually providing that corrective feedback when the student is getting it incorrectly? The interventionist is appropriately responsive to the child. As I said, this is child-driven. We wanted the professionals to rate if these participants are indeed child-driven. The interventionist targeted skills that seem appropriate for the child. We want to make sure that the skills that we were targeting are functional skills for that child. The interventionist reinforced attending skills as appropriate for the child. Are we working on the learning how to learn behaviors? Does the professional think each participant was doing an adequate job, a great job, or not so great job? And then finally, if applicable, the intervention appropriately handle aberrant behavior. So if aberrant behavior occurred, how did the interventionist handle it? So these 12 areas are what the professionals rated each of the 25 participants on their video of implementing pretty much comprehensive behavioral intervention. Now here's how it went. This is how the study went. It started with a mock exam. All the 25 participants took a mock exam. That mock exam of knowledge of behavioral intervention. After they were done with the mock exam, each participant then got the discrete trial teaching probe, which I talked about, the measures. I'll talk about how that was conducted in a minute, followed by the conditioning item probe, talk about that in a minute, and then that general teaching probe. This was the order of the study. So in the mock exam, I'll go over it. They had up to, it was a multiple choice exam where they could answer questions about behavior and analysis, about applied behavior analysis. They were all done on the computer, so each participant had to do this on a computer. The questions were based on a computer. They could not have access to their phones or any technology. They couldn't Google the correct answers. This was just their knowledge of behavior analysis without the help of any social media. There was a proctor who would look it over to make sure that they wouldn't go on their phones or Google or find any information about it. So we're really evaluating if it's an independent test. They had up to 4 hours to complete the exam, so they could take as little time as they want, but they could not take more than 4 hours to complete the exam. And the exam consisted of 176 questions across the 12 content areas. So they answered 176 multiple choice questions. So that's the mock exam condition. This discrete trial teaching condition, each participant worked with a 6-year-old boy diagnosed with autism. They were provided 3 stimuli cards, and they were pictures of sports teams, because those were things that the child did not know and that they were not targeted in their clinical intervention, so we could assess how well the participants were doing, the adult participants were doing in implementing discrete trial teaching. They were given this instruction. In the beginning of each probe. I want you to use discrete trial teaching to teach these labels receptively. You have 5 minutes, but if you'd like to stop before then, please let me know. If you require additional materials, let me know. So they could take, could take up to 5 minutes to implement discrete trial teaching receptive labels, which means they have to teach them to point to the angels, point to the cardinals, point to the rangers, whatever it may be, and we rotate the cards for each adult participant. Now, what they would ask for usually are reinforcement systems like a token economy, which we'll get to in later modules, about how to actually reinforce correct responding. They sometimes ask for more cards so they can make it from a receptive label task to a matching task. So some of the participants would say match angels, and they would match the picture of the angels. That's this one, in case you guys don't know which one the angel is. And use matching as a way to teach receptive language. And sometimes they ask for other toys and items that they could use as reinforcers. So in this probe, they had up to 5 minutes. They could stop at any time they want, but they had up to 5 minutes to implement discrete trial teaching. And remember, we were looking at each adult participant ability to implement those steps of discrete trial teaching. So it's not really what the learner is doing, it's really what the adult participants doing in terms of implementing discrete trial teaching. For the conditioning item probe, we used a 3-year-old boy diagnosed with autism. His favorite item was Buzz Lightyear, and we rotated different toy items for each adult participant. So one adult participant might get a pirate sword, another one might get the flinging chickens, another one might get bouncing balls, and the other one, who's probably the most difficult, would probably get jacks and have to make that more fun. So the probe started with the child and the adult participant in the room, and the researcher said this: I want you to try and make item, so if it's chicken flingers, I want you to try and make chicken flingers more preferred than Buzz Lightyear, to the best of your ability. You have 5 minutes, but it would be, if you would like to stop before then, please let me know. So once again, the goal is this child loved Buzz Lightyear, which makes sense. All children love Buzz Lightyear in Toy Story, it seems. and the adult participant had to make another item more preferred than Buzz Lightyear. And in doing so, they had 5 minutes to do it. But if they wanted to stop after a minute, they could stop after a minute. They just could not go over 5 minutes. Then what we did was the general teaching probe. The general teaching probe, each participant can work with whatever child he or she selected. So it could be a child that they knew or a child that they didn't know. And when I mean know, it could be that they know them because they're in the agency, or they know that they work with them. And what the therapist did is they said this to the adult participants: I want you to run a short session with whatever the child was. Take 5 minutes to look over anything and let me know when you're ready to begin. Once you're ready, you'll have 5 minutes to work with that child. You can teach whatever you think is best, however you'd like to teach. So in this probe, we're seeing the ability of the behavior analyst or the behavior technician to implement just whatever behavior analytic procedures he or she wanted, to teach whatever curriculum he or she thought was necessary. So it's completely up to that adult participant. So if they want to implement discrete child teaching, they could. If they want to implement shaping, they could. If they want to implement the teaching interaction procedure, they could. It was whatever is best for the adult participant, and they had 5 minutes to do so. So they absolutely had 5 minutes to do so. And remember, this general teaching probe was the ones that we gave videos of it to those two professionals. Those two professionals both had their BCBAs. They both have been in the field for a long time. One had a master's degree, both had a master's degree, one was pursuing a doctoral degree. Both were directors of agencies, so they actually directed agencies, were responsible for training and supervision and running the agencies. And the professionals did not know any of the participants. They had no previous history with the participants. And as I talked about earlier, they had to say whether they agreed, strongly agreed, disagreed, or neutral based on the questions of the social validity questionnaire that we gave them on these 5-minute probes. So here's the data from it. I want to go over it. So on the x-axis are the different conditions: the multiple choice exam condition, the discrete trial teaching condition, the conditioning items condition, and the social validity condition. On this y-axis, it represents the scores of the discrete trial teaching and conditioning score and the exam score. So these are the percentage correct for the exam, or the percentage of steps correct for a DTT and conditioning item score. On this x-axis represents the social validity, so from the scale of 0 to 7. So these 3 points, the multiple choice exam, the discrete trial teaching, and conditioning, the data is represented on this y-axis. And for the social validity score, it's represented on this y-axis. Now what you're going to see is a bunch of symbols. So there's different symbols, and each symbol represents a different participant. So when we look at the exam score, the score on the multiple choice exam, the average score was about 53%, 53.1% to be precise, with a range from 30 to 76. So this is how they scored on that multiple choice exam, which really closely resembles the multiple choice exams to obtain your BCBA. Here's the score on discrete trial teaching. Their range is 77 to 100, with the average being 93%. Here's the conditioning items, with a range from 50 to 100, with the average of 78.2%. And here's the score on social validity, a range of 5.4, so you're looking over here just to remind you, so 5.4, with a range of a score from 4 to 7. So if you just visually look at it, and visual analysis is so important in our field, you can see for the most part these scores are higher average than your score on the multiple choice exam. So what we really want to do is a correlational analysis. We want to see if there is a correlation between the exam score and DTT, your multiple choice exam score and conditioning item, and a correlation between social validity and the exam score. Now this is going to be technical. I do not think any RBT needs to know this, but just so you know, in case you are interested, we ran pretty much a Spearman rank order correlation test, which is a statistical test that determines if there's a correlation between these different variables. So we're looking to see statistically if there's a correlation between the multiple choice exam score and any one of the 3 of these. So let's go over the data. Here's a discrete trial teaching score and the exam score. So discrete trial teaching, here's on the x-axis, goes from 75 to 100 because that's where they fell in. And the exam score goes from 20 to 80, that's where they fell in. And once again, each dot represents a participant. So that's how it's set up. So here's the correlation coefficient based on the Spearman rank order correlation. Based on a correlation coefficient we found between no relationship and a moderate positive relationship between exam scores and GED scores. That means that the exam score increased. As the exam score increased, so did the TD score. So as you improved on your multiple choice exam, as you scored higher in your multiple choice exam, you're more likely to score higher on the discrete trial, your implementation of discrete trial teaching. However, when you look at the stats and the analysis on the Spearman rank, there's no significant relationship between the two variables, which means that they're not correlated. There's really no correlation between how you do on your performance on discrete trial teaching with how you do on answering questions on the multiple choice exam. Well, let's look at the graph for conditioning and multiple choice exam. Here's the multiple choice exam on the y-axis. Here's conditioning score on the x-axis. Once again, 40 to 100 and 20 to 80. So what we see according to the correlation coefficient here is there's a moderate negative relationship between the variables, meaning as exam scores decrease, the conditioning scores increased. So if you perform worse on the exam, you're more likely to perform better on conditioning items effectively. However, once again, if you look at the p-value, there's no statistical correlation. So once again, there's no correlation of how you did on the multiple choice exam with how you did in conditioning items. Finally, we want to look at social validity. So here are the scores on social validity from 3.5 to 7. Exam scores, once again, on the y-axis, 2080. The dots represent each participant. So according to the Spearman correlation coefficient, there's a moderate negative relationship between the variables, meaning as an exam score is decreased, the social validity score is increased, pretty similar to what we saw with conditioning item, but once again, no significant relationship. So there's no correlation between how you do with your implementation behavior analysis, behavioral intervention for individuals with autism, with how you score on the exam. So what does this mean? What can you take home from this as an RBT? What can you take home from this as a supervisor? What you can take home from this is that it doesn't matter how you do on the multiple choice exam. That will get you to become an RBT. That will get you to BCBA. But it's not indicative of your actual performance. So just the fact that you passed the multiple choice exam does not mean that you're qualified to implement quality behavioral intervention to individuals diagnosed with autism. You are qualified when you can actually do it. So do not fool yourself in thinking you passed the multiple choice exam and you're great at implementing the different procedures that we'll talk about. You're great at implementing those procedures when you can implement them with a high degree of fidelity. So that's one pitfall. The other pitfall that we have found recently, which we're really warning against, something that we're not comfortable with, something that we encourage you guys not to do, is the assistant trainer. Right now, and heading into the new level of the RBT, is that you can have an assistant trainer. Now, there's times that the assistant trainer might be great, and those are people you want to seek out. For example, an assistant trainer now doesn't have to have a BCBA. They don't have to be a BCBA or BCBAD or BCABA. They can pretty much be anyone. It could be someone great. It could be like someone like Pat Fryman or Ron Leaf or Bob Cagle, someone who's been in the field for 40, 50 years, who are absolute experts in behavior analysis. Absolute experts. And they're people that you would want to get training with. Just because they don't have the BCBA, if they're the ones providing an assistant trainer, that is great. Those are the people you're wanting. But also an assistant trainer now could be someone with very little experience. Very little experience. Technically, an assistant trainer could be an RBT who's taken this 40 hours. The agency says, well, I kind of like you. I vouch for you. I'm comfortable vouching for you. You're going to now help me train. you're going to give the workshops, you're going to give the talks. That's not who we want, because who we want are the experts. If I had a son or daughter who is talented enough to be a college athlete or a professional athlete, these are the people I'd want. I would want Coach K or Nick Saban or John Wooden. I would want these as my coaches. So when you're getting a trainer, when you're getting a supervisor, someone is helping you out, you need to look. Make sure that the trainer has the qualifications. Ask them what the qualifications are. I would not be comfortable with the assistant trainer if they don't have a lot of experience, because it's not going to help you become the very best RBT that you're capable of becoming. Finally, a third pitfall is time. This should not be a time-based kind of certification. Now the BACB says all you need is 40 hours. If you do 40 hours and you pass the competency-based exam and you pass the multiple choice exam, which we know does not correlate with actual performance, if you pass those areas, you can be an RBT. But the fact is, it's not time. It should not be time. You should not be comfortable with time. Agencies should not be comfortable with time, because it should be based on performance. It should be when you're able to implement discrete trial teaching, when you're able to implement conditioning items, when you're able to implement the teaching action procedure, when you're able to take data. That's when it should be that you are competent. So not something based on time, something based on actual performance. So don't just be comfortable with time. Don't go and say, I did this 40 hours and now I just want to work independently. As an RBT, be self-reflective, be self-evaluating and say, you know what, I'm not ready, or I'm ready to do this. I need more training in that. Because this should not be a time-based certification. It should be a performance-based certification. So that takes you to the end of Module 2. And we will be going now to Module 3, where Joe will be talking about terminology.